Hello and welcome to For Vaginas Only, the podcast about everything female. I'm your host, Dr. Celestine, bringing you important information about understanding your health and body in the way you wish your doctor would actually explain it. Hello, For Vaginas Only YouTube family. I'm Dr. Celestine, your host of the For Vaginas Only podcast brought to YouTube. In this episode of the For Vaginas Only podcast, we are going to be talking about preeclampsia. Preeclampsia can be a severe condition of pregnancy that has to do with high blood pressure. We're going to get into what it is, who's most at risk for it, what are some of the things that you can do to maybe prevent it, what your doctor is looking for in order to diagnose it, and what that means for your pregnancy and delivery. So thank you so much for joining the For Vaginas Only YouTube family, and stay tuned for this episode. All right, guys, so what is preeclampsia? Preeclampsia is defined as elevated blood pressure in a woman for the first time during pregnancy that starts after 20 weeks gestation, which is about 5 months of pregnancy. So some women, there's other conditions of elevated blood pressure. Some people just have blood pressure that's elevated without being pregnant, right? That's what we call chronic hypertension. Some people will just have gestational hypertension, which is just hypertension or high blood pressure in pregnancy without some of the other features of preeclampsia that we'll get into. But that is the hard and fast definition of preeclampsia. And there are certain people that are at higher risk for this and certain people that are not. Sometimes it happens even without risk factors. So the reason why this is important is because that there are many high blood pressure conditions in pregnancy, of which preeclampsia is one of a few causes. But all of these high blood pressure conditions are actually the most common cause of maternal death, which is a pregnant mother dying in pregnancy when you look worldwide. So globally, it's 16% of the reason for maternal death in the world. So it is important because it is very dangerous and it's a high cause of maternal death, which is something that has gotten a lot of publicity lately, especially when it comes to Black maternal death, because Black mothers are 2 to 3 times more likely than any other race to have a maternal death, which is crazy and which is a topic for a whole other podcast episode. But maternal death is a big deal. Young women are usually pregnant, and to have a young mother, especially with no other medical problems and of whom you're not expecting to pass away, die, and the fact that high blood pressure is 16% of that reason globally is crazy. Just think of the amount of people that are in the world and the amount of pregnant women that are in the world, and 16% of them can die from a high blood pressure condition. So preeclampsia being one of those conditions makes this a really important topic. Now, there are some people that are just at higher risk of getting preeclampsia, such as it being your first pregnancy, being greater than or equal to the age of 35, having multiple gestations, meaning you're having twins or triplets, having an elevated BMI greater than 30, having underlying kidney disease or diabetes, and those women that come into pregnancy with high blood pressure conditions already, so known high blood pressure prior to pregnancy. However, what's interesting, although these are risk factors and although those are things that we watch for as doctors, the most common reason or the most common person that gets preeclampsia is somebody without any risk factors, which is crazy. So as a physician and as an OBGYN, I'm really looking out for this in everybody. It's one of the main reasons we have so many prenatal visits and we check your blood pressure every time. It's something we're constantly on the lookout for. So how do we as doctors make this diagnosis? So there's a few factors that we look at. Obviously, we've talked about, I've said the word blood pressure so much. So obviously, we look at your blood pressure. So your blood pressure has 2 values. It has a top number, which is your systolic blood pressure, and a bottom number, which is your diastolic blood pressure. So for preeclampsia, your top systolic blood pressure is greater than or equal to the number 140, and your diastolic is greater than or equal to the number 90. And this has to usually be taken 2 separate times of this elevated blood pressure, at least 4 hours apart. And then we're looking a little bit closer as to, is this preeclampsia or not? Because once we have that value, we also have to look at a few other things. One is having protein in your urine. So protein in the urine is measured in 2 different ways. Sometimes we do a 24-hour collection of urine. Sometimes we kind of do a spot collection or protein creatinine ratio, and there's different values for that. But it's mostly having elevated blood pressure and the protein in your urine that gives you the diagnosis of preeclampsia for most people. Another thing that we can kind of look at if you don't have the protein in your urine is some other factors in your blood work that indicates to us that your organs are being affected. So some of the impaired organs of preeclampsia can be your kidney, your liver, your lungs, and even your neurological status, because we look at if you have a headache or not, okay? Also your platelet level. Platelets are part of your blood count, and having a low platelet level in addition to high blood pressure could be a sign of preeclampsia, even without having protein in your urine. Basically, because preeclampsia affects your entire body, it's almost like a vascular condition as well, and this is why it affects the baby and the mom. So the biggest fear of preeclampsia is that it's going to progress to eclampsia and the fetal effects. So first, let's talk about the fetal effects. Since I mentioned it's a vascular condition, basically what that means in terms of the baby is that it's impairing the blood flow through the placenta. Now the placenta is in the uterus, kind of feeding the baby and giving it its nutrition, so to speak, and it's impairing the blood flow, so impairing the blood vessels that are connecting mom and baby. And that impaired blood flow leads to things like small babies, which we call intrauterine growth restriction. It leads to low fluid around the baby, so the baby is swimming in a fluid-filled sac inside of your uterus, and having low fluid has negative side effects for the fetal growth as well. It can lead to things like placental abruption, which is where the placenta actually separates from the uterus and starts to cause a lot of heavy bleeding and lead to an emergency delivery. And on the delivery front, it can lead to preterm delivery. So the other fear is the progression to eclampsia. So eclampsia is that when you have preeclampsia that we're managing and watching, but then you have a seizure, and that has detrimental effects for mom as well as baby. So some rare consequences for eclampsia or an eclamptic seizure is impaired brain function and trauma to mom. And it's not always a natural progression. You don't always have preeclampsia and then eventually if it's not managed, you get eclampsia. Some people with preeclampsia never get eclampsia. And some people with the lowest blood pressure being managed really well will sometimes still have a seizure. So it's hard as a physician to always know what's going to happen next for many different things, and preeclampsia is one of them because it doesn't always follow the natural progression of first you have high blood pressure, then you have protein, then you have preeclampsia, then you have a seizure. It doesn't always go like that. It's not always a smooth transition, and sometimes it all happens at the same time. So it can get very complicated and very crazy. But that is basically preeclampsia in a nutshell. So a lot of the things that we do as physicians, one, we try to prevent preeclampsia. So if you're known to have some of these risk factors or if you've had preeclampsia in the past, sometimes your doctor will put you on a baby aspirin or an 81 milligram aspirin tablet daily, starting from early on in your pregnancy. That's because, like I said, it's a vascular and blood pressure or blood vessel disease. So we want to make sure that we're not impeding the blood flow through your vessels. And one of the ways that we do that is with a little bit of a blood thinner in the baby aspirin that you take daily. Another thing that we sometimes do is blood pressure medications to try to keep your blood pressure down low. And if you're in the hospital per se, and we're kind of monitoring your progression, or if your preeclampsia is worsening, you can be started on a magnesium drip. Now, magnesium does not feel great. I've never had it personally, but it can make you lightheaded, a little loopy. Sometimes you can't even walk properly and get out of bed when you have a magnesium drip. And magnesium is started when we're worried about the preeclampsia progression to eclampsia because it's simply to prevent seizures. That's the reason why not to torture you. A lot of moms, they're stuck to the bed. They don't like that. And I can totally understand that. But our main goal is to prevent the seizure from happening. If we're worried about that, magnesium is sometimes the best way to go. There's other things that we can do depending on certain risk factors or certain other conditions you might have that prevents us from putting you on magnesium. But magnesium is kind of the gold standard way for us to prevent you from having a seizure. So that is pretty much preeclampsia in a short and sweet and simplified nutshell. It can get very complex depending on the doctor, the patient, the setting, what's going on with the baby. It's just way too much for me to cover in a podcast episode, and it can be very individualized for each mom, each baby, and each pregnancy. But I'm hoping that this episode at least gives you the initial understanding of what preeclampsia is, so that if it's happening to you, you can acquire the knowledge that you need to ask your doctor the right questions about what's going on with you and what the plan for management is. So thank you so much for listening to this podcast episode, and let me know on forvaginasonly.com or my 4vaginasonly Instagram page at 4vaginasonly. Send me a DM, write in my comments if you have any questions or any experiences with preeclampsia that you want to share. I'm always learning from you guys, like I always say, just as much as you're learning from me. And also, if you're on the 4Vaginas Only YouTube, you can write some comments down below as well. Make sure that if you're on the YouTube page, that you're subscribing. If you like this episode, hit the thumbs up, let me know. And I'm so excited about sharing my knowledge and getting to know you guys on so many different platforms. So thank you so much for listening, and I'll catch you on the next episode. Bye.